Good morning, everyone. Thank you so much for joining us on this great September day. Thank you again for joining us for another fantastic Envy quarterly webinar. Dr. Jimenez and Amy and I have really enjoyed putting these together for you all, and we hope that you find them useful. This is our Face Forward to Fall acne webinar, and we're going to be talking about the SilkPeel Dermalinfusion with our ClarityMD acne solution, as well as the ClarityMD acne home care. And both of these modalities are extremely efficient when you use them a la carte, but boy, when you put them together, the results are absolutely amazing. I hope everyone has had a great summer. I know it feels like summer in many places of the country, and but we are falling into fall, and we're all getting back to school. We're getting back to our routines. We're really starting to plan, believe it or not, for the holidays. So what does that mean? That means we're in a season of transformation. We can really give our patients and clients the ability to actually transform their skin into a flawless complexion. So it also can be a flawless fall. It's a great opportunity in the marketplace to address acne for your patients and clients. Acne is definitely the most common skin disease, and it affects over 40 million Americans, and of all types of skin. So the dark skin, light skin, everyone really can suffer from acne. And the thing that's so frustrating is I know everyone is either frustrated with their own acne or has experienced a family member or loved one that has had struggles with acne, either their teenage years or as they get a little bit older in life as their hormones change. I think people don't really realize that 85% of all people have had acne in their lives, either on their face or chest, and then also a lot of people get them on their back and other parts of their body. So why do we want to treat acne? Well, because it's a very easy answer, and that would be self-esteem. It's really hard for these younger people to get acne when they're just coming into, they're coming of age. They've got all the peer pressure, the social pressure, they're 12 to 14 and they've got the hormones, and then they get all the acne. It's like, wow. Thanks. So it's really awesome for us to be able to provide you all with a solution that's not going to be dependent on prescriptions and taking oral medications and or topical prescriptions that have a lot of side effects. And then also with adult acne, there's so many men and women out there that were so proud in their junior high and high school years, they never had a pimple in their life, and then they turn 40 and they have all this acne, and they're like, what happened to my skin? So now they not only have their own type of peer pressure because they're fighting pimples and wrinkles. So I think everybody really strives for that beautiful, flawless, healthy looking skin, and now we can give it to them in areas that they're not going to have to suffer through a stage to get to that great skin. We're going to be able to give them that great skin with no downtime, with no irritation, and with no redness. So it's an amazing home care product, Felipe, that you have created. We just are blown away by the results. The
Thank
solution
you.
that you have created for the SilkPeel in combination, it really is absolutely mesmerizing what you can accomplish with these two different modalities. So why don't acne products typically work, in your opinion?
Yeah, there's a plethora of acne products on the market, and they have been there for a very, very long time. I mean, we've been treating acne, for decades upon decades. And the biggest problem really in treating acne is not so much that the products don't work, but I think it has more to do with what we call non-compliance, right? So let's say you've got a younger patient that comes into the office, and obviously you want to help them as best you can. You want the best outcomes for them, and so you give them a prescription, to use a product. You ask them to use it twice a day, every day. And the biggest problem, though, these days is that the fact that these products don't work fast enough for the younger generations, and the fact that these products actually can cause some tolerability issues like dry skin, redness, or irritation. Both of these factors really cause these younger patients to become non-compliant. Non-compliant meaning that they do not use the products as directed or as frequently as the physician would like them to use it. So what happens, right? So once they start experiencing some of these tolerability issues, and they don't see that their acne goes away fast enough, obviously they're going to stop using the product, or they don't use it, as frequently as they should. And obviously, when they stop using it correctly, they're not going to see the results that they want. What happens then? Well, they don't get the results that they want, and obviously they're not going to come back, and repurchase that product again, right? So with ClarityMD, we actually addressed both of these issues, in that it works super fast, works up to 3 times faster than the very best prescription or OTC products on the market today, and obviously it does so without harming the skin, without causing any kind of irritation or redness as well.
And then, and then we've got the 1-2 punch kind of thing going here, because,
Yeah.
the Clarity MD, the new formulation that you created with the bisabolol and the bakuchiol, is very effective as a standalone treatment. But when you combine it with the Silk Peel, it's absolutely amazing. And tell us a little bit about how this combination therapy, why is this so unique and different, especially, when we're talking about the Silk Peel device?
Yes, that's an excellent question. Most of the time, when you go to the doctor and get a prescription for an acne medication, obviously it's either a topical medication that you put on your skin, or it's a product that you have to take orally, like oral antibiotics. In our case, we actually take a different approach, more of a hybrid approach, so that not only do we ask our physicians to send their patients home, obviously with our Clarity MD acne system, our take home system. But in the clinic, we also recommend that physicians actually perform a silk peel procedure on their patients, especially those patients that have that inflammatory acne and the non-inflammatory acne as well. And the reason for this is that it works synergistically with the take-home product. So, as you'll see in the next couple of slides, the SilkPeel device is very, very unique in how it actually helps to treat acne. And as you can see here, it does it in 3 different manners. Okay, so first of all, we have vacuum that we run through the actual device, and actually through the handpiece. And what this vacuum does is it actually serves a couple of purposes. Number one, it serves to bring the skin in contact with our high density brush head within our pore clarifying handpiece. And then as the operator glides this handpiece over the skin, basically you're doing a couple of things. First of all, obviously you are able to exfoliate away some of those dead cells on the surface of the skin. But at the same time, what you're doing is you're de-roofing those comedones or the inflammatory acne. As you're doing that, the vacuum actually serves to evacuate whatever is inside of those infected pores. Now, at the same time that we're doing all of this, we're actually also infusing a solution that contains our PCX technology, which is essentially a combination of salicylic acid, bakuchiol, and bisabolol. So, what we're doing effectively is, as we're evacuating this bad stuff out, or these acne causing bacteria out of these pores, we're infusing the pores with a solution that will actually also help kill the bacteria that's still inside of the pore, and also to help prevent the excess production of sebum in the pore as well. So in a sense, we are deep cleaning those pores. We're removing everything that will cause the acne lesion, and in doing so, we actually help to heal those lesions a lot faster. But again, that's only step number one. How do we keep from getting that, those lesions again at home? So the best way to do that is to use our ClarityMD home system twice a day, every day. And obviously, when you use that in conjunction with the silk peel, obviously you're going to get some very, very good results in record time.
Yeah, I mean, I feel about sometimes when I try to explain um, how unique the silk peel is and how efficacious it is, I sort of talk about, you brush your teeth with your electric toothbrush or your sonic toothbrush, and that does a really good job. That's sort of similar to using like a Clairsonic brush on your face with your cleanser, and so you get pretty clean. But when you go to the dentist and they clean your teeth, when you walk out of that dentist's office, you're like, oh my God, my teeth feel amazing. They just, and that is what a silk peel does. So it's sort of like,
Exactly.
the sonic toothbrush versus a dental cleaning is using your Clairsonic brush every day and then getting a silk peel. So your skin will never be as clean immediately afterwards from a silk peel than when you do that treatment. And now that we have this great technology that really prevents the acne from continuing to form, and you're pushing that serum all the way down a clean pore to the dermal junction, you really, there's just nothing out there that can compete, because nothing can get that deep into the skin, nor can it really take all the, like Curtis says, the prisoner exchange, taking the bad guys out and putting the good guys
The
in.
good guys in.
Yeah, so,
Exactly.
and you made some really good guys. They work really well.
Yes, thank you.
So, and this is another slide that's one of my favorites. And tell us a little bit about how to read this slide,
Yeah.
and then also tell us a little bit about how those vacuoles sort of move laterally, because I think that's also very powerful in this slide.
Yeah, absolutely. When we talk about the silk pill, when we talk about the dermal infusion technology, a lot of people don't quite understand what that means or what it really does in skin. And this slide is very powerful in that it really summarizes, just really in one graphic, exactly what the silk pill does and what dermal infusion does for your skin as well. So if you look at the graphic there, there's two sides to it. There's one side that says silk peel, the other side says no silk peel. So as the names suggest, the side that says silk peel obviously has been treated with the silk peel. The side that says no silk peel has not been treated. Again, this is a single punch biopsy. Believe me, it took us a while to try to get a punch biopsy that had half of it was treated and the other half was not. And as you can see on the right-hand side that says silk peel, you see a couple of things. You see that that epidermis is really swollen. It's actually twice as big as the epidermis on the far left-hand side where it says no silk peel. That's what the normal thickness of that epidermis is on the left-hand side, the far left-hand side. The right-hand side, the far right, that's a swollen epidermis after it's been treated with the silk peel. Okay, and the little white bubbles that you see there, those are little vacuoles, okay, and they're filled with a solution that we actually infuse into the skin. So really, this really tells you what dermal infusion does. It really serves kind of as a transport system that actually infuses or delivers this solution very, very deep into the skin, actually as far as the dermal epidermal junction there. So that's really important to know. Now, the second thing that you'll see is on the side that was not treated with silk-peel, some of that epidermis actually has started to swell as well. That's what we call the leading edge. Okay, what does the leading edge mean? The leading edge means that not only are we able to infuse the solution in the areas that we actually treat with the silk peel, but we're also able to infuse that solution into surrounding areas that may not have been treated with the silk peel as well. And the reason that happens is that we use pneumatic pressure to actually force that solution into the skin such that the actual force that we use will actually cause the solution to actually penetrate into non-treated areas as well. Okay, that's what we call the leading edge. Okay, and to my knowledge, there's no other device on the market today that can do something very similar to what SilkPeel does. Keep in mind that the biggest difference between SilkPeel and other devices is that SilkPeel actually infuses solution into the skin using pneumatic pressure. Other devices on the market simply drip solution onto the skin, and they kind of, just kind of rely on passive diffusion to, transport the solution into the skin. So
Right.
that's really the biggest difference there.
Yeah, and I think this is probably, when we do these webinars, this is probably one of the most powerful slides that you really do prove exactly what the silk peel is doing inside the skin. So it's just it's I love this slide. It's probably one of my favorites. And let's talk about how easy the procedure is for the patient. You're getting that kind of efficacy. And when you're also talking about other devices, when we talk about silk peel and dermal infusion, we don't even really like to call it microdermabrasion because the microdermabrasion part is really just a method of action for us to get these solutions down deep into the skin and to also to evacuate the pores. So if they're completely, apples and oranges. So let's talk a little bit about, how quick that this truly is a lunchtime procedure.
Yeah, indeed, it is a lunchtime procedure. It's 20 minutes long. Really, what it is one pass over the neck, and then you do two full passes, certainly on the face. And again, it's very fast. Again, there's no downtime to the patient whatsoever. It's not like doing a more aggressive laser procedure where the patient probably needs to go home thereafter. They probably can't return to work. That's not the case with SilkPeel. With SilkPeel, you can definitely return to work. At best, your coworkers will notice that your skin looks visibly, smoother, certainly
More
brighter,
hydrated,
certainly
plumper.
more hydrated. If you do use color cosmetics, you'll see that those look a lot more even on your face as well.
The other thing I want to point out too, since we are talking about acne procedures, this is the opposite of what someone's going to expect if they've gone in and done acne facials or acne treatments before. Because if they're typical acne treatments, you go in, the esthetician just picks your face to death. It really hurts. You don't want to be there. By the time you get done and they release you from the torture, you look like you've been beaten up. This is painless extractions. It's not uncomfortable. The machine, literally, the handpiece and the power of the silk peel device itself, we literally are just, it's like a wet dry vac. We're just sucking out the debris, and so it's not a pushing sensation. It's not somebody that's squeezing out things that could definitely damage the pore. And many people that go in for acne treatments, they can have scarring just from an esthetician trying to release some of those acne lesions. So it's such a nice experience, especially for people that have been frustrated in trying to go to places to get their acne resolved. It's a beautiful way to go in that you literally look better when you're done than when you walk in the door, even when you're talking about inflammatory acne.
Absolutely.
Let's talk a little bit about your fantastic formulation.
Yeah, absolutely. So, at the heart of the silk pill procedure, obviously, we talked about dermal infusion and really delivering a solution deep into those pores. And, really what does the magic for us there is going to be our Clarity MD Pore Clarifying Pro Infusion solution. So this particular solution is particularly different than what you would find out there, in terms of, topical acne products in that it does contain salicylic acid, but we also rely very heavily on two botanical ingredients called bakuchiol and bisabolol. So the bakuchiol is a really interesting ingredient because it is multifunctional in that it's a great antimicrobial, but it also has retinoid-like properties in that it does help to regulate that 5-alpha reductase enzyme that can overproduce sebum in skin. And on top of that, it's actually a pretty good anti-inflammatory as well. So it does help to treat and actually prevent the PIH that you would get from the inflammatory acne as well. Now, the bisabolol is also a wonderful anti-inflammatory, but it's also a great anti-irritant. So it does help so that the procedure itself is more comfortable for the patient, so that you don't feel very much irritation. As a matter of fact, I've had these ClarityMD silk pill procedures before, and definitely it's been very, very comfortable for me. I've never felt any kind of irritation whatsoever. Now, we talked about the silk peel. We talked about how it works, in terms of evacuating the pores and in delivering that Clarity MD solution into the skin. But what does it really do for the skin? And as you can see here, this particular patient was only treated with silk peel. Okay, so nothing else, no take home products whatsoever. This is silk peel on its own. As you can see here, not only were we able to treat his inflammatory acne, but we were also able to treat his PIH as well as his acne scars. So you can see there after 10 weeks, boy, his skin looks completely different than what it did when we first started treating him. And you can see there's a huge difference there on his forehead, on his cheeks, on his chin, just an entirely different texture of skin as well. The
Yeah, I
next
mean, it,
slide.
it not
Yeah.
only worked on the breakouts, but I think the texture and the tone of the skin is completely like a different person.
Absolutely, absolutely. Here you can see as well on this young lady here, she has inflammatory acne there. Again, after 10 weeks, her skin is pretty much clear. She's got maybe a little bit of PIH there on her forehead, but other than that, I mean, she is completely clear. Again, this is something that not only helps to treat the acne you have, but it also helps to prevent for future breakouts as well. On the next slide, we've got this is kind of an interesting case because here you've got more comedonal acne and you've got a lot of PIH, a lot of acne scarring. But as you can see here, after just 10 weeks, again, this patient received silk pills every 2 weeks. Boy, you can see just a world of difference there in the acne scarring, in the PIH, the texture of the skin. I mean, completely different, skin texture, skin tone,
And there's
as
no
Cindy mentioned.
Yeah, and there's no, I mean, she didn't take oral antibiotics. She didn't take any
No,
sort of prescriptions. She didn't have to go in for chemical peels that stung when she was getting the treatment and then super flaky. So, she's embarrassed for 2 weeks because her face is flaking off. So all of this you can get these results without any side effects or downtime or any negative, processes to get to these amazing results as well as being comfortable.
absolutely, absolutely. So we talked about this before. We said, hey, look, silk peel works wonderful by itself, but what if we add the Clarity MD take-home products to that? I mean, it'll just supercharge that treatment, and obviously it'll help to prevent, the breakouts in between silk peel procedures as well. So here is kind of a nice little introduction to our Clarity MD take home products. And again, what sets these apart is that they're alcohol free, they're benzoyl peroxide free. As a matter of fact, we use the same technology that we use in our Clarity MD Pro Infusion solution, in that we do use our PCX technology. Again, that consists of delivering salicylic acid, bakuchiol, and bisabolol deep into the pores. And again, what's wonderful about this system, really what sets it apart from other systems on the market today, is that it's fast. Again, it works up to 3 times faster than other products on the market. As a matter of fact, you can see here we've got some numbers there. In just 7 days, we're able to get rid of almost 60% of inflammatory acne lesions. Again, that's just unheard of. After 2 weeks, we get rid of 90% of those lesions. Again, that's unmatched by any product on the market today. After 6 weeks, again, it's up above 90% reduction in acne lesions. But really, what that tells you is that, not only are we able to treat the existing acne lesions that you've got on your skin, but we're also able to prevent that acne from coming back thereafter. So that's super, super important to keep in mind. I think that we're missing, some of the writing that we had here on the right-hand side, but it does treat all major causes of acne, whether it's, the inflammation, the bacterial infection down there, the P. acnes infection, or the overproduction of sebum in skin. So really, it's an all-in-one acne take-home product. And again, the wonderful thing about it is it's simple to use, just two products used morning and night.
And the other thing too, I want to just keep reiterating, these results are only with the home care. So we haven't put the two modalities together for the before and afters. So
Absolutely.
that is what's so powerful. And then also, Felipe, for people that know clindamycin, those sort of products, can you
Sure.
kind of give us a range of the strength of this combination, of the ClarityMD with the cleanser and the gel in terms of how strong it is compared to like something like clindamycin that people use?
Yeah, absolutely. So if you look at the kill rates for both clindamycin and bakuchiol, and even benzoyl peroxide for that matter, the kill rate for P. acnes bacteria for bakuchiol actually comes closer to that of clindamycin. So, obviously that means that it's a lot better than or more efficacious than benzoyl peroxide at killing the P. acnes bacteria. But I guess antimicrobial properties, if you will, come closer to that of clindamycin. So it's very, very potent in skin. But again, the difference between using a bakuchiol versus a clindamycin is that, as you all know, with clindamycin, and really any antibiotic out there, antibiotics can actually cause the P. acnes bacteria to become resistant after time, after prolonged use of these antibiotics, whereas bakuchiol is very much like benzoyl peroxide in that there's no way for this bacteria to really become resistant to it. So that's another really cool thing about Clarity MD.
Right, but it doesn't dry you out. It doesn't have all the problems that benzoyl peroxide has.
Exactly, exactly.
So how do we use it?
So it's very simple to use. I mean, just use both the cleanser and the gel twice a day, every day. Now, there is a little trick to using the cleanser. When you have very mild acne or you've got adult acne, you get, the occasional breakout, you can just go ahead and lather on that Clarity MD cleanser onto your face, for about a minute. Then you can go ahead and wash it off with warm water, towel dry, and then move on to step number two. Now, if you're younger, if you've got more moderate to severe acne, where you've got, oilier skin as well, what you want to do is you want to go ahead and lather that cleanser on for about a minute onto your face. And you want to go ahead and allow that cleanser to sit on your face, kind of like a mask, for another 1 to 2 minutes. Now, I've heard of people who leave it on, for up to 5 minutes. And really what that does is it helps to really suck out, all of that excess oil in the skin. And in doing so, it really prepares your skin and really your pores to better accept that step number two, which is the Clarity MD clarifying gel. So that's a little trick, for everyone that uses the Clarity MD cleanser. Now, moving on to step number two, there's two ways that you can really use the Clarity MD clarifying gel. Number one, if you do have more mild acne, or if you have the occasional breakout, you can certainly use it as a spot treatment. Or, if you've got more moderate acne, severe acne, you definitely want to be able to use that full face twice a day, every day. And that will definitely help to not only treat the acne that you've got, but also will help to prevent it as well. Now, the other thing that we need to let people know is that Clarity MD gel does contain an alpha hydroxy acid. Obviously, it's a glycolic acid, so you do have to make sure that you tell your patients that they should definitely wear a sunscreen after using this product, because it will definitely make your skin a little bit more sensitive to sunlight as well.
Especially also with after a silk pill. You always want to do extra sunscreen, and in this, there's never can be enough sunscreen. So
Yeah, absolutely,
always
absolutely,
reapply, and apply liberally.
absolutely.
So
So
I love these acne pads, Flea Baby, because they're great for lazy people.
Well, they can be used as a standalone for sure.
They really can.
Obviously,
It's like,
when you're at work or when you're, going to school, you can definitely, use these to wipe off the excess oil throughout the day for sure. But you can also use them in conjunction with the Clarity MD take-home products as well. So in that case, you would actually wash your face, cleanse your face with the Clarity MD cleanser. Then you can obviously go ahead and apply these pads onto your face. They kind of act like a toner, if you will. And then you can go ahead and apply that Clarity MD gel thereafter onto the face as well. With this particular product, it does contain 2% salicylic acid. It does not contain our PCX technology. So this is more of a kind of more of a preventative product, more of a product that you want to use in between your Clarity MD treatments, your take-home product treatments, morning and night. As we said before, if you go to school, if you work, definitely take these with you throughout the day. Wipe off the excess oil, and you'll see that that in itself will actually help to prevent future breakouts as well.
yeah, it's great for college and high school sports and teenagers, and as a makeup remover, not for your eyes but for your face, at night before you go to bed. And everyone loves pads, and I've heard from the field that these pads are not drying at all. Everyone really, they've been very well received out in the marketplace.
Absolutely. So, okay, so we talked a little bit about Clarity MD, the take-home products. We talked about how fast they are. We talked about how they don't irritate skin. But let's look at a few pictures. Let's look at some proof of what it actually does. So, this is a picture of a young lady. She actually participated in one of our clinical studies for Clarity MD. As you can see there at baseline, she does have some inflammatory acne, what I would probably characterize more as mild acne, both on her cheek and her forehead. As you can see, just after 1 week, I think she's probably got one live lesion left there, inflammatory lesion, maybe two on her face. But really, what she's got left is really some PIH there, but no real live acne lesions there, either on her forehead or her cheek area. I think she's got a live one there on her temple, but that's about it. So it works super, super fast. In this case, you can see that it got rid of probably 85% of her acne in just 1 week, which again is just unheard of for any acne product on the market today. In the next slide, you'll see a young lady that actually has more comedonal acne, non-inflammatory acne, if you will. As you can see there, after 6 weeks, I would say we probably got rid of maybe an excess of 65% of that comedonal acne. And again, that's unheard of. Most products take about 12 weeks just to get rid of about 35 to 40% of your comedonal acne. And again, with Clarity MD, you can definitely get rid of a lot more, that comedonal acne in less time as well. So one thing is to get those excellent results back in the lab, where everything is controlled, everybody's using the product. But what kind of results can we expect, from, just the regular person buying this product, from, their local dermatologist? And as you can see here, this young lady here just had some fantastic results. At baseline, she had what's more like moderate to severe inflammatory acne, both on her forehead and around her mouth area as well. You can see after 6 weeks, there are no live lesions on her face whatsoever. What she's got left is acne scarring as well as the PIH. At 12 weeks, you can see her face is pretty much clear. It is completely different. The texture, the tone, is completely remodeled from where she started from. And again, this is just the Clarity MD take-home products, nothing else. No SilkPeel, no antibiotics, nothing else. Just
And
the Clarity MD take-home
and
products.
you can see her self-esteem improving every 6 weeks.
Absolutely, absolutely. She's got that nice, beautiful smile there at 12 weeks, as you can
She
see.
does.
So, we got a couple of other pictures to show you again. On the left-hand side, we do have, again, another person that actually sent in some before and after photos. In this case, again, we're looking at some inflammatory acne there on the side of her face, her cheek area, as well as her neck area. As you can see, after just 1 week, She has very little to no live lesions whatsoever. At 2 weeks, all of those lesions are completely gone. Basically, what we're dealing there is a little bit of redness left over, a little bit of PIH, but that's about it. She has absolutely no acne, no live acne lesions there whatsoever. On the right-hand side, you do see a young man that has more comedonal acne, definitely all over the side of his face, the certainly the temple area and the forehead as well. As you can see, the after picture, I think we're missing the legend there, but that should be 2 weeks there. 2 weeks after using ClarityMD, you can see that a lot of that comedonal acne has subsided. And boy, we definitely have a happy customer there as well. So as you
So
can
let's,
see,
oh, go ahead.
I'm sorry. I was just going to say, as you can see, Clarity MD doesn't just work in a controlled environment, like
Hmm.
in a clinical study, but definitely it can work for anyone at home. Again, as long as they continue to use the product, twice a every day as directed, they should all see very, very quick results. And again, without the tolerability issues of some of the other products on the market today as well.
Yeah. And the thing that that really hits me is that the redness, the irritation in the skin just goes away so quickly.
Absolutely,
So let's
absolutely,
let's show that awesome testimonial, Felipe, that someone sent in
absolutely.
to us.
Coming right up.
All right.
Okay, stand by.
ClarityMD, you guys are amazing. Your products are amazing, and I tell everybody about them. About a year ago, I woke up with a face full of acne. I don't know if it was a hormonal change or what it was, but literally everywhere I touched, there were bumps. I freaked out. I went to Carrie at Spa Benjamin, who I love, and she immediately got me hooked up on your products. And after about 2 weeks, I saw a significant difference. And it's been a year now. And not only has my skin cleared up, and not only do I not have any blemishes, my face, all the red splotches in my face have pretty much gone away. I can walk out of my house without makeup. And I know that might not sound like a big deal, but for me, somebody who's always battled with acne like her whole life and skin issues and hyperpigmentation, it's just not fun. But I literally can walk outside and feel comfortable in my own skin. And as a former actress, I can't tell you how confident your products have made me feel. And I don't know what you put in, I don't know what you do, but the fact that they are unabrasive, that they don't make my skin flake, that they're not harsh, and that there are no side effects, you guys are geniuses. Thank you. I love you.
So yay, Felipe, good job.
Thank you. Well, I think it's a team effort, and certainly, creating the products is one thing, but I think that we have to give credit to our fantastic customers that we have out there. That do recommend the products and do keep after the patients. Make sure that they're using them correctly.
Mm-hmm. So let's talk about what our suggestion would be for a perfect silk peel acne facial protocol.
Yeah, absolutely. It's very, very simple. So obviously you want to start out by, cleansing the face with the Clarity MD Deep Pore Cleanser before the Silk Peel procedure. Obviously, we talked about this before. You definitely want to lather, the product onto the face, for at least 1 minute. If the patient does have oilier skin, you definitely want to leave it on there as a mask for another 1 to 2 minutes. Go ahead and then rinse it off. Towel dry. Once the skin is nice and dry, then you go ahead and perform that silk peel procedure, again using the pore clarifying handpiece with the appropriate brush head, and obviously with the Clarity MD pore clarifying pro infusion solution as well. Thereafter, this is kind of the cool part here. What you want to do is actually ahead of time, what you want to do is place our Clarity MD acne pads as well as our Clarity MD gel in the refrigerator. And after the silk peel procedure, what you want to do is you want to take these pads and you want to apply some of this gel onto the pad. Make sure that it's all over the gel, the pad. Then apply these pads with the gel onto those areas of the face that do have, more comedonal acne or even inflammatory acne. and you want to go ahead and leave these on the skin for about 5 minutes. Thereafter, you want to go ahead and remove the pads. You want to go to wipe the excess gel into the skin. After the gel has penetrated into the skin is nice and dry. You want to go ahead and finish off with applying the Lumixal Moisture Lock sunscreen onto the skin, and they should be ready to go. And obviously, you just want to make sure that you do send your patients home with a ClarityMD acne solution kit, and you definitely want to make sure that they're using both products twice a day, every day. So, as we talked about just moments ago, we do use several products to effectuate this facial. So you're going to definitely need the ClarityMD cleanser. You're going to need the ClarityMD Pro Infusion solution. You're going to need both the pads as well as the clarifying gel. And then obviously you're going to need the Moisture Lock sunscreen as well to finish off. So now we talked about what kind of results you get with SilkPeel alone. We talked about what kind of results you get with ClarityMD alone. But what kind of results can you expect when combining both the SilkPeel and the at-home ClarityMD treatments? Well, as you can see here, we got a patient that had, some inflammatory acne, but she had a lot of acne scarring, a lot of PIH. And as you can see here, it took us a few months, but we were able to really remodel all of that acne scar. And she had some pretty deep acne scars there. And as you can see, after about 5 months, and she would come on and off. Most of the time she would come in, at least twice a month, but sometimes, she would only come in once a month. But look, even with that, you can see that her skin is completely remodeled after the 5th month there. I mean, it's totally different from where she started from. So needless to say, I mean, she's one happy customer. And again, it just goes to show you the power of combining both SilkPeel as well as ClarityMD at home treatment as
Right.
well.
And no pain to the patient, no downtime to the patient, no hiding, none of that. So it's just it's miraculous.
Absolutely, absolutely.
So what would our so once somebody gets their skin to where they want it to be and they're happy, what do we do then?
Yeah, so you definitely want to put them on a maintenance protocol for sure. So they want to have a silk peel at least once a month. And really what you want to do in those silk peel treatments is really help to clear out those pores. Just make sure that you get rid of anything that could potentially cause acne thereafter. You want to make sure that they continue to use that Clarity MD cleanser daily. If they can't do it twice a day, at least once a day. And then you definitely want to continue to use that Clarity MD gel as a spot treatment thereafter. Now, there is one little tip here. Some people have told us that if they do use that Clarity MD gel, actually full face, they actually see some excellent anti-aging effects from it. So it's not only good for getting rid of your acne, but it's also a great anti-aging product as well. What they tell us is that it definitely helps to refine their skin texture, certainly helps with some of the finer lines in their skin, helps to certainly reduce pore size as well. So they are happy campers. We have people that certainly have that adult acne. They're the ones that have told us about this, and they love using it as a full face treatment every single day. So, we talked a little bit about maintenance, but we haven't talked about how frequently you should be performing SilkPeel procedures on your patients. So this really depends on the severity of the acne in your patient. So if they have more mild acne, adult acne, they can definitely have these SilkPeel procedures done once every 2 weeks. You can definitely suggest that they have a total of 4 to 6 procedures done over this time. If your patient does have more moderate to severe acne, especially if they have more inflammatory acne, you definitely want to start out by treating them every week until that acne starts to subside. Then you can go ahead and switch to doing these procedures every 2 weeks thereafter. In this case, you definitely want to have them do at least 6 to 8 procedures In both of these cases, whether you're dealing with mild acne or moderate or severe acne, you definitely want to make sure that these patients are using that ClarityMD take-home products at home twice a day, every day, throughout this entire time that they are receiving the SilkPeel procedures as well. Um, so,
So
in this
yeah,
case,
this is all about kind of like what we use before and after, and then we'll be talking a little bit about how to combine different things with ClarityMD. So is there anything we need to know before we come in
yeah,
for our silk peel or after we come out of our silk peel? Any sort of things we need to be
yeah,
aware of?
absolutely. You know, when you're using both the SilkPeel treatments as well as ClarityMD to really fight acne, what you really need to know is when you're using that ClarityMD gel, you want to make sure that you stop using it at least 48 hours before having your SilkPeel procedure. And basically, in doing that, basically what you do is you allow that stratum corneum to kind of build up a little bit before having that SilkPeel procedure. And what that does is it prevents any scratching on the skin. As you know, when you thin out your stratum corneum and then you do a silk peel immediately thereafter, there's a good chance. I mean, it's not it doesn't happen very often, but you know, in some rare instances, you can get some kind of scratching of the skin only because your stratum corneum is so thin that you know the brush tip or even the diamond tips can actually penetrate through that very thin stratum corneum and actually scratch that viable layer of the epidermis as well. So you know that's the only real thing that you need to remember when using ClarityMD take-home products along with the silk peel procedures as well.
And I know a lot of people have their favorite products that they've been using for years. And so when they're either adopting a new protocol, sometimes they like to use, you know, they kind of cherry pick from different lines and things. So if people have their favorite products that they're already using, this is just a guideline to help you kind of understand where ClarityMD would slide into the use of other products.
Absolutely. I think the only one that you need to really be aware of is the Accutane. You know, we definitely want to avoid using, you know, either our Clarity MD products or certainly our Silk Pill procedures on patients that are actively taking Accutane. You definitely want to have them stop using it, you know, for at least a couple of months before you actually get them on Clarity MD or even the Silk Pill procedure as well. But other than that, you can definitely combine it with the use of tretinoin, with other antibiotics, with sulfur, with retinol, with vitamin C, or even glycolic acid.
So tell me a little bit, when you say apply with Clarity MD gel, are we mixing them?
You can. I mean, we definitely have people that have mixed tretinoin with the Clarity MD gel. And in doing so, I think what we found is that it helps so that it kind of ameliorates, you know, the some of the tolerability issues that you might get from using tretinoin. So as you know, I mean, tretinoin is can be irritating to the skin, can cause some redness for sure. But some of our patients out there have definitely told us that by mixing it with the Clarity MD gel, that they can avoid some of these tolerability issues.
Fantastic. And then vitamin C you would do after the Clarity MD gel.
Yeah, you would
Okay.
definitely want to use it after, and just keep in mind that vitamin C again is an acid; it's L-ascorbic acid, so you know you might feel a little bit of irritation thereafter. But if you're using like a 5% or less vitamin C, you should not have any problem when using it with the Clarity MD gel.
Okay, great. And then obviously we don't need to add any more glycolic since the gel already has a nice 10% in it.
Absolutely.
Okay, great. So let's talk a little bit about the prizes. We got a couple surprises to tell you guys about. So we came up with three promotions with different buy-ins. So it can really, anyone can afford at least one of these promotions. And if you're one of our partners that do a lot of business with the ClarityMD as well as the solution, you can really take advantage of some serious percentages off. So the first promotion is just super easy. It's just purchase a 6-pack of ClarityMD Acne Home Care. They all come in a 6-pack. So buy 6 and we will give you 6 acne skin clarifying jars for free. So it's an easy buy one get one, sort of like pay less. So when you do it at your facility, just say buy one get one free. And yeah, people love that, and they love the pads. And once you get the pads into patients' hands, they will continue to repurchase those. Those are definitely sort of a little cult following. The second promotion is our mini SilkPeel Acne Facial Bundle. So if you buy 2 cases of the ClarityMD solution, that is a buy-in of $537. We will give you over $190 worth of product for free. So that's a 35% discount. And what you can do is, I like to do promotions where if you buy a series of SilkPeels, then you would be able to give to your patient a free acne solution home care kit. And then we also are giving you an acne pad and Lumixyl sunscreen to do in your back bar, so you don't have to take that out of your inventory. That's a la carte and free from us. The third promotion is even a better discount if you can do an $804 buy-in, which many of you can and do all the time. So that's a 52% savings. So we'll be giving you 12 sets of the acne solution, so that's 2 cases, and then you'll be getting 3 jars.
Actually,
and
3
tubes.
cases.
3 cases. Oh, excuse me. And we will be getting you 3 jars
I'm
and
sorry,
3 tubes.
I think I am mistaken, unless I'm
Yeah,
reading
I
this
think I
wrong.
think it's 2
It's
sets.
2
So
cases, yeah, 2
perfect.
cases.
Perfect. So 3 cases of the solution we're buying, and then you're going to get 12 individual home cares, which is 2 6-packs. Then you'll get 3 jars of the acne pads and 3 tubes of the sunscreen, so you can use that in the back bar as well as a great giveaway. And I love the thing, fall in love with your face again, flawless fall, flawless complexion. There's a lot of buzzwords you can use for marketing. And then we also made this great point of purchase display. So these will be shipped out when you place your order for the promotion. And you can put this up by your cash register, you can put it in your restroom, you can put it in your treatment rooms. So if you want more than one, I guess, Felipe, they could just, when they're calling in for their orders, they can just ask to have, a couple more if they needed them, I guess.
Absolutely,
Suppliers.
absolutely.
Okay, so that's great. So you have a gift with purchase, which is a $25 value, which is getting the free pads. And then you also have a gift with treatment, which would be the entire kit, which would be a gift of $50. And then also, if you want to do a really big one, you could combine those, since we're giving those to you anyway for free. So you could say, so the first 6 people that come in for a series of treatments, they would get not only the home care, but the acne pads. That would be a $75 value to them just for coming in and signing up for a series of acne facials. So let's talk about this crazy thing that we're going to be launching here soon. And I love this. I love this this ad. I think it's fantastic. So I don't know if Amy.
I am
on.
here. I'm
Oh,
here. Can you hear
good.
me?
Okay.
Hi, good morning. It's Amy in marketing, and we're very excited to talk about a new program we're going to be launching within the next couple of weeks called What's in Your Waste Jar. And you can see the beautiful model and the disgusting waste jar full of everything that you have removed from their skin, and just looking at the juxtaposition of what is so disgusting within the skin compared to the beautiful woman after her treatments really has shown us at Envy the value of looking at waste jars. So, being beautiful isn't pretty. When you are treating with a SilkPeel dermal infusion device, you know that you are looking at a lot of disgusting waste that's vacuumed out during the procedure. It may be a gross thing to look at, but it's also one of the best ways to demonstrate to patients how their progress is coming along, showing them all of the sebum, dead skin, and comedones that you're removing from their skin. And we have found in the field that this is a very effective way to kind of demonstrate to patients what it is that you're doing to really improve the condition of their skin. So we will be asking you to show us what horrors lurk within the skin of your patients. Stay tuned. We're going to be asking for photos of waste jars and of patients to show who is related to what waste jar. We're going to be hosting this contest on social media sites, and we will be issuing prizes. So stay tuned for more information. And we look forward to seeing a vast collection of disgusting waste.
Thank you, Amy. And then also, I want just to remind everybody to make sure when you go and place your orders to talk to customer service and make sure that they have your correct email address. I know sometimes people move, they change their emails, so that you get this information when we do launch this program. It's going to be coming from our email system from corporate. So make sure, just kind of do some house cleaning, and when you place your orders, just make sure they've got the correct email address. So when these campaigns do start, you don't miss out on the awesome prizes that we're going to be giving away. Just to kind of showcase how ClarityMD has really been getting a lot of buzz in the media. We've been in a lot of the top magazines and getting some great reviews from beauty editors as well as physicians out in the community. We would love for you guys to come visit us at the ASDS. I believe that's in San Diego in November. So our booth number is 526. So if you guys are going to come be there, come by and say hi, and we'd love to see you and chat and see how we can continue to grow your business. We also are putting together and have been putting together continuing education that's available for you 24/7, and it's our Envy University. So if you cut and paste this link and enter the password SilkPeel Training, there are 12 videos that are posted that go from the pore clarifying handpiece video that talks about what we're talking about today on this webinar, as well as the diamond head, eye lip treatments, lymphatic drainage, as well as all of the body parts. So if you have new hires, people that just want to kind of get a refresher, this is a great start for them for continuing ed. And it's 10:58. We got 2 more minutes. So way to go, Felipe. You're right on time. So thank you so much. I know everyone is super busy. No one has a minute. And we really do appreciate the time that you spend with us each quarter. We hope that it's beneficial, and we love it that we can gift you some wonderful promotions. So let us know if there's anything you need. I've got my phone number at the bottom. That's my cell and also my email address. So if marketing, any other questions that you have, we'd be happy to help you with that. And these promotions are valid through the end of October. So we're giving you a lot of time to take advantage of these promotions. So I'm assuming, Felipe, that they can order several times if they order a lot of these things during the month. So
Absolutely.
yeah,
Absolutely.
so you have 6 weeks to take advantage of these promotions. So we really appreciate the time that you spend with us, and we definitely want to make it worth your while. So just let the customer service people know that you came on the live portion of the webinar. If you have other staff members that were not able to make the webinar, we will be emailing you a link to the recorded version of either this morning's webinar or the one we're going to do in a couple hours. And they can also listen to it. And once someone listens to the recording, then they all are also allowed to take advantage of the promotions. So just let us know. And we're doing this on a, we believe everybody. So just make sure that you do your part and we'll do ours. So thank you, Felipe. Always love working with you. Thank you, Amy. Looking so forward to the What's in Your Waste Jar promotion and challenge. I think it's going to be really fun. So
Thank you, Cindy.
And you don't need a code for the promotion for this webinar. Again, we're doing it on the honor system. So if we feel like people are cheating a lot, then we'll probably start doing codes. But right now we feel like everybody's enjoying the education. So no promotional code, just let them know that you did, that you were on. And we also have a list of who jumps on the calls. So
Absolutely.
So if we wanted to
Cindy,
check, we could.
I just wanted to thank you as well, Cindy, for always being just a fabulous host here. You've been, we've been doing this together for a year now, actually.
I know.
So time does certainly fly, but just wanted to thank you for being a stellar host and, for bringing us all this wonderful information as well.
Well, thank you. And then does anybody have any quick questions? I don't think that we told anyone to write those in the meeting chat this morning, but anytime we have these webinars, you guys can always jump in and ask questions as Felipe is doing his talk, and then if we can always answer those at the end of the call.
Absolutely. So we do have a couple of questions here
Oh, good.
that have come in. So we have one from Alana. She says, "Can you use oil-free moisturizer with these products without affecting the results?" Yeah, absolutely. Some patients, they tend to get dry skin, obviously from using products, for acne, or even products that do contain alpha hydroxy acids. So the answer is yes. As long as the moisturizer is oil free, as long as it is non-comedogenic, you can definitely use it for sure. I would definitely use it as after the last step. So after applying the gel onto the skin, I would definitely try to use it as sparingly as possible, but it is possible to use these. Okay, and we've got one more. I think this question is for you, Cindy. This comes to
Oh.
us from Callie Reynolds. She asks, "Do I need a code for promotion through this webinar?"
No, we just talked about that we're doing it on the honor system. And unless people start cheating, we're going to just kind of do it through that. So you do not need a promotion code. Just let them know that you did listen to either the morning or the afternoon call.
All right, perfect. I guess we don't have any other questions at the moment.
Okay.
So I think we'll just thank everybody again. Just wanted to thank everybody again for taking the time to join us this morning for our fall webinar on acne. I truly appreciate it. And if you have any further questions, you can certainly reach out to Cindy. You've got her telephone number there listed, as well as her email address. And again, if you do have any further questions, you can also contact our customer service department, and they would be more than happy to answer any questions that you may have.
Awesome. So yeah, thank you guys. And if we weren't able to get onto the call, just go ahead and look for that recording and share that with your other staff members. Okay,
Excellent.
guys.
Well, thank
Thank
you.
you.
Have a wonderful day.
Okay, talk to you soon.
Thanks. Bye-bye.
Bye.